HIV Aids by Rivalenko. Whoa, wait a second. What's HIV Aids? HIV stands for Human Immune Deficiency Virus. HIV weakens the immune system, which is our defense system against diseases and infections. When the immune system is damaged to a critical point, it can lead to AIDS, acquired immune deficiency syndrome, making the body more susceptible to other infections and diseases. People with HIV don't automatically have AIDS, especially with the advanced treatment we have access today. Most people living with HIV in the developed countries such as Australia will never develop AIDS. HIV/AIDS, or human immune deficiency virus, is considered by some authors a global pandemic. However, the WHO currently uses the term global pandemic to describe HIV. Pathogen of HIV. HIV, a retrovirus, the human immune deficiency virus HIV, was identified in 1983 as a pathogen responsible for the acquired immune deficiency syndrome, AIDS. AIDS is characterized by changes in the population of T cell lymphocytes that play a key role in the immune defense system. Symptoms of HIV. Firstly, there are the flu-like symptoms, in which include fevers, chills, rashes, night sweats, muscle aches, sore throats, fatigues, swollen lymph nodes, and mouth ulcers. And secondly, there are the actual AIDS symptoms, which is rapid weight loss, recurring fever, profuse night sweats, extreme and unexplained tiredness, prolonged swelling of the lymph glands in the armpits, groin, or neck, diarrhea that lasts for more than a week, sores of the mouth, anus, or genitals, red, brown, pink, or purplish blotches on or under the skin or inside the mouth, nose, or eyelids, memory loss, depression, and other disorders. How is HIV transmitted? You can get or transmit HIV only through specific activities. Most commonly, people get or transmit HIV through sexual behaviors and needle or syringe use. Only certain body fluids, blood, semen, preseminal fluids, rectal fluids, vaginal fluids, and breast milk from a person who has HIV can transmit HIV. HIV is not spread by, firstly, air or water, mosquitoes, ticks, or other insects, saliva, tears, or sweat that is not mixed with the blood of a person with HIV, shaking hands, hugging, sharing toilets, sharing dishes, silverware, or drinking glasses, or engaging in closed mouth or social kissing with a person with HIV, drinking fountains, and lastly, other sexual activities that don't involve the exchange of body fluids, for example, touching. HIV can't be passed through healthy, unbroken skin. How is HIV treated? The treatment for HIV is called antiretroviral therapy, ART. ART involves taking a combination of medicines called an HIV treatment regimen every day. ART is recommended for everyone who has HIV. ART can't cure HIV, but HIV medicines help people with HIV to live longer, healthy lives. At present, there is no way to cure HIV infections or remove the virus from the body. However, drug therapy can slow down the virus and the damage that it does to the immune system. The treatment may need to be continued for the patient's lifetime, whether the patient has AIDS or advanced HIV disease. Statistics. Let's look into the statistics of HIV/AIDS. HIV, the virus that causes AIDS, is one of the world's most serious public health challenges, but there is a global commitment to stopping new HIV infections and ensuring that everyone with HIV has access to HIV treatment. The number of people with HIV. As of 2018, approximately 37.9 million people are infected with HIV globally. There is about 770,000 deaths from AIDS in 2018. New HIV infections. An estimated 1.7 million individuals worldwide became newly infected with HIV in 2018. 1.6 million infections were among people ages 15 and older. 160,000 infections were among children ages 0 to 14. HIV testing. Approximately 79% of people with HIV globally knew their HIV status in 2018. The remaining 21%, about 8.1 million people, still needed to get HIV tested. HIV testing is an essential gateway to HIV prevention, treatment, care support, and services. How to control it. Both medical professionals and the government of Australia have both taken the HIV disease into a serious matter. PEP is use of antiretroviral drugs to prevent HIV following a high risk exposure. Ideally, PEP is commenced with 72 hours of exposure. PEP has been shown to significantly reduce the risk of HIV infection following the exposures to HIV. To put it simply, the prevention factor is a condom.